Hello, everyone, and welcome to Haelsoft EdTech. My name is Dr. Ezeadichie Emmanuel Chinedu, and I will be an instructor for this course, Foundations of Veterinary Anatomy. I am excited to guide you through this learning journey because anatomy is one of the most important foundations in veterinary medicine. Now, before a veterinarian can diagnose disease, perform surgery, give injections safely, or understand how the body functions, they must first understand anatomy. Let's say, for example, now we all know there is a common nerve found at the what? The hind limb, which is called the sciatic nerve. Now, if a veterinarian, when trying to administer injection at the gluteal region, injures that sciatic nerve, this could cause what we know as knuckling effect in any animal, be it cat, be it dog, be it goat, be it sheep or cattle. You see the animal, instead of standing on its hoof, for example, for the ruminants, they tend to stand on their what? Their fetlock, which is what we know as knuckling. Now, if you do not have a proper understanding of your veterinary anatomy, you would be making these mistakes all the time and thereby damaging your what? Your client's animal's posture. Many students see anatomy as difficult, but for me, I don't. And they see it as difficult because the unfamiliar terms and large amount of information that is found in anatomy. That is why many students see it what? Difficult. But in this course, we are going to simplify it and make it practical, visual, and easy to understand. Now, these are the course objectives. Now, by the end of this module, you should be able to understand anatomical language like a professional, identify basic tissues and their functions, recognize major bones, joints, and muscles, build a mental map of the animal body. Now, these are the core 5 units, 6 unit courses that we'll be going through. The first one is Introduction to Veterinary Anatomy. The second one is Histology, where we'll be talking about tissues. Yes, the basic what unit of an organ is the cell. And histology helps us to what? To be able to view this cell on a what? On a microscopic level using a microscope. And we'll go further to talk about osteology, which is the bones and structure. We'll talk about arthrology, which is joint and movement. The myology, which is the muscles and function. Then lastly, we'll talk about what's planchnology, which has to do with what? The internal organs. Okay? Yes. Now, we will learn how to see the animal body clearly from understanding anatomical language and tissues to bones, joints, muscles, and all the internal organs, and be able to apply it in the veterinary field. This is what we're going to go through throughout this course. So, welcome once again to Haelsoft EdTech, and let's begin our journey into the foundations of veterinary anatomy. Imagine a veterinarian gives an injection in the wrong location on a dog. Now, this is a simple procedure, but then this procedure suddenly damages an important nerve, which is the sciatic nerve, like I mentioned earlier on. Now, why would that happen? often the answer is anatomy, because that veterinarian doesn't have basic understanding of what is her anatomy. And today's lesson is the introduction to veterinary anatomy, where we will begin by understanding the body planes, the directional terms, and body cavities. Because unlike in humans, where they have the superior, the inferior, we don't use that in anatomy. And if you don't have a basic understanding of these terms, you will be guessing. And part of this lecture is for you to stop guessing and start seeing, start having knowledge why it is so. Now, for the body planes, we have the sagittal plane, the transverse plane, the dorsal plane, and these are the three fundamental planes of orientation. Okay? Now, when you hear the word sagittal, you would not really understand the word sagittal, okay, until you understand the word midline, the midline. And the midline, or the middle of the body, is that imaginary line that divides the animal's body into two equal halves. So you have to have this at the back of your head. When you hear the word midline, it divides the body. It's an imaginary line that divides the body into two equal halves. And with the understanding of this midline, you can then define what sagittal line is. Now, a sagittal line or a sagittal plane is that imaginary line that divides the body into two unequal halves. Yes, unequal halves. So any line that is not running at the midline from the head to the toe of the animal, it's a sagittal line. Now, if you see this arrow, going this way, and you see it going this way as well. This now is a sagittal line. It's a line, it does not divide the body into two equal halves. Okay, that is a sagittal line. And when you talk about dorsal plane, now the dorsal plane divides the body into the upper part and the lower part. So when we're talking about these points now, let's say a line divides this horse body from this place at this midpoint here. Let's say this line here, okay? Now, this up part is what we refer to as the dorsum, which is the part facing above the back, going upwards. Now, animals are not humans. Animals are quadruped animals, okay? They stand on 4 feet. So when you hear the word dorsum, the dorsal plane is a line that divides the body into the upper and the lower part. That's we having the upper part, which is called the dorsum, and the ventral part, the lower part, which is called the ventral part of the body. Okay. Then we have the transverse plane. Now you see this straight line that runs here. This straight line. This is what we call the transverse plane. Yes. This is the transverse plane. Okay. It divides the body into the cranial and the caudal part. Now, the cranial, when you hear the word cranial, they're talking about towards the head. So anything facing towards the head is the cranial part, while anything facing towards the tail is the caudal part. So anything moving towards the tail of the animal is called the caudal part, while those moving towards the head, the cranium, is called the cranial part. So that's where the word transverse plane comes in. The transverse plane divides the body, as you can see it here. It divides the body into the upper the cranial aspect and the caudal aspect. Okay. Then we move into the directional terms. Yes. Let me go back. Okay. Yes, we move into the directional terms. So you see, what I was defining earlier on, we were talking about the three planes, and then I added one, which is the midline. Now, the midline is very important. And then we moved on to the sagittal line. And remember, the midline is an imaginary line that divides the body into two equal parts, while the sagittal plane or the sagittal line divides the body into two unequal parts. And the dorsal plane divides the body into the upper part and the lower part for a quadruped animal. Now we then move into the directional terms. And when we talk about directional terms, we have the cranial, the caudal, the proximal, the distal. Okay. Now for cranial, anything towards the head, anything that is going towards the head is the cranial part is called cranial. Okay, they will tell you it's cranially located. Okay, it's cranially located. Hmm? That's let's use for example now the neck, the neck region is cranially located, but then the the what's it called? The oxcozay, that's this region that I'm pointing on is caudally located. Okay, so because this is caudally located because it's towards the tail. So when you hear directional term, anything moving towards a particular region bears that name. So if it's moving towards the head, it's called cranial. The direction is cranially located. Then if it's moving towards the tail, the direction is caudally located. Then when you hear the word proximal and distal, these two are they are almost the same but opposite. Now proximally located, now proximal, when you see this forelimb now, you see this forelimb, okay? Now the point that is closer to the point of insertion or the point of attachment is called proximal, while the region that is far away from the point of attachment or the point of insertion is called distal. So let's say, okay, let's use this for example, okay, the humerus, okay. Now the humerus, the head of the humerus is is proximally located. You understand? The head of the humerus, you understand, is proximal, while the condyles of the humerus are distal because the head is close to the attachment. Why the condyles, the two condyles are far away from the point of attachment of the humeral bone. Okay, so this is how you describe any location precisely. And then we move into body cavities. Now, body cavities are those opening within the body. Those opening within the body. Yes, where the internal organs are anchored. Now we have the thoracic cavity. It's the open space within the thoracic region. So you see this thoracic region, which is from this place to this place. As you can see the ribs, from this place to this place. The cavity, the open space within this region is called the thoracic cavity. And within this cavity, we have the lungs anchored, the heart is anchored, two internal organs, two splanchnic organs. That's where the word splanchnology comes from. Internal organs, visceral organs, okay? So the thoracic cavity is a cavity that anchors or that it anchors some organs, is a space found within the thoracic region. Yes. While the abdominal cavity is a space found within the abdominal region. So you see this abdominal region, okay? The space found within this abdominal region is called the what? Abdominal cavity. And within this abdominal region that has the abdominal cavity, we have the stomach anchored here. And not just the stomach, we also have the kidneys. They are anchored within the what? The abdominal. Yes, sorry. Yes, the abdominal region. Yes. We also have the kidney anchored within this abdominal what region. And then we have the what? The pelvic cavity, where this place where I'm pointing, where we also have the entrance into the pelvic inlet and the what? The pelvic outlet. So the pelvic cavity is the space found within the pelvic region where the what? The ox is what? Found. So cavities are what? Open spaces. They are what? Open spaces. Now you should understand that in teaching angles, in teaching direction, you have to use real life clinical mistakes to be able to master all these things. When talking about veterinary anatomy, you should be able to use yourself as the sample. You understand? You have to use yourself as a sample to master the knowledge. Like me, way back when I was studying, for my undergraduate degree in veterinary medicine, I was using myself as what? The sample, the mannequin. That was what I used myself. Sometimes I stay in a quadruped position to be able to pass the knowledge into myself. And that is the best way as an anatomical student to learn. Okay? Then I'm not going to really, spend too much time on this topic because today was to introduce the foundation of veterinary anatomy and also list out the 6 core units that we're going to be taking. Then go a little bit deep into what? Body planes, directional terms, and what? Body cavity. And on our next video, we are now going to start going deep into what? Every other key aspect. Not really deep. This is just introducing the course. Like I said, the foundation of what? Veterinary anatomy. And on our next video, we'll go into continuing what? Histology, explaining just a brief, to give you what it means and, a picture of it. Also go deep into osteology, arthrology, the movement of joints, myology, muscles, and then that's it. So thank you once again for tuning into this video. And my name is Dr. Ezeadichie Emmanuel Chinedu, and I am the instructor for what? For Haelsoft EdTech. See you again. God bless you.